Imagine a world where waiting for a heart transplant is no longer a source of anxiety or uncertainty. A world where one of your body's most vital organs can be replaced by technology permanently. This isn't a distant dream. It's our reality in 2024. Today, we're witnessing a groundbreaking development that's not just a medical milestone, but a beacon of hope for millions worldwide. The first successful implantation of the Bivacor total artificial heart. But how did we get to this point? What makes this artificial heart so revolutionary? And what does this mean for the future of heart transplants? Could this be the dawn of a new era in the fight against heart disease? Keep listening to find out. The history of heart transplants. To truly grasp the significance of the Bivacor breakthrough, we need to take a step back to 1967. That year, Dr. Christian Barnard performed the world's first successful human heart transplant in Cape Town, South Africa. It was a monumental achievement, but it quickly became evident that the demand for donor hearts far exceeded the available supply. Today, cardiovascular diseases claim nearly 17.9 million lives each year, and many of those in need never receive a transplant. This critical shortage inspired the quest for an artificial heart, igniting decades of research, innovation, and relentless pursuit. Early artificial hearts were often cumbersome, with external pumps connected to machines, offering patients little quality of life. The Jarvik 7, the first total artificial heart implanted in 1982, was a major leap forward. But it came with significant risks, including mechanical failures, infections, and limited device longevity. Despite these challenges, the dream of a fully functional artificial heart endured, pushing scientists to innovate further. Introducing the Bivacor TAH. Fast forward to 2024, and we stand on the brink of a new era in artificial heart technology with the Bivacor total artificial heart. This isn't just another device, it's a revolution in design and function. Utilizing magnetic levitation, a technology typically associated with high-speed trains and space exploration, the Bivacor TAH offers something truly groundbreaking. A contactless, frictionless environment made possible by magnetic levitation in the Bivacor TAH greatly lowers wear and tear, a major problem with earlier artificial hearts. Strong magnets suspend the rotor of the heart, which drives blood circulation, so enabling it to spin at great speeds without physical contact. This technology guarantees that the heart can run for many years without mechanical degradation afflicting earlier devices. The outcome is a heart capable of supporting a patient for a far longer length of time, maybe acting as a permanent replacement instead of a transplant bridge. What's more, the Bivacor TAH is equipped with advanced sensors and software that continuously monitor and adjust its performance in real time. It can detect changes in a patient's activity level and automatically adjust blood flow, mimicking the adaptability of a natural heart. This level of responsiveness is unprecedented in artificial heart technology. The groundbreaking surgery. The turning point came in July 2024 at the Texas Heart Institute, a globally known leader in cardiovascular research and treatment. World-class surgeons working on the operation painstakingly replaced the failing heart of the patient with the Bivacor device. This was the result of years of research, development, and clinical trials, not any typical process. Unlike traditional heart transplants, which require intricate sutures to attach the donor heart to the patient's blood vessels, the Bivacor TAH uses quick connect fittings. These allow for a fast and secure attachment to the patient's arteries and veins, simplifying the process significantly. Once in place, the device was activated and began pumping blood, a moment that brought immense relief to everyone in the room. This wasn't just a successful operation, It was a historic turning point. The patient who had little chance of survival without a donor heart now had a renewed lease on life. For millions of people suffering from end-stage heart failure, this operation wasn't just a medical procedure, it was a glimmer of hope. Post-operative success and challenges. The days and weeks following the surgery were crucial. Within hours, the patient began showing promising signs of recovery. The Bivacor TAH ensured continuous blood flow and oxygenation throughout the body, demonstrating its reliability and the body's adaptation to it. Still, obstacles persisted, as with any innovative medical treatment. Carefully watched were long-term device integration, immune response, and infection risk. The medical team also had to take into account the psychological effects on the patient, who now possessed a totally mechanical heart. The patient's welfare depended on regular follow-ups and thorough testing. Notwithstanding these challenges, the result was very favorable, ushering in a new era in artificial organ transplantation. Despite these challenges, the outcome was overwhelmingly positive, marking the dawn of a new era in artificial organ transplantation. The success of this surgery paves the way for broader adoption of the Bivacor TAH, potentially eliminating the long, uncertain wait for a donor heart for future patients. However, ongoing research and development are essential to refining the device, addressing unforeseen issues, and expanding its use to a wider population. The future of artificial hearts. The success of the Bivacor TAH has opened the floodgates for even more innovative advancements in artificial organ technology. Scientists are now exploring how this technology can be adapted for other organs, such as kidneys, lungs, and even the liver. The implications are staggering, a future where organ failure is no longer a death sentence. Near term, the emphasis will be on improving the Bivacor TAH's capacity. Integration of wireless technology is already under progress by researchers, enabling remote monitoring and changes. Imagine a time when doctors might simply use a tablet app to change the performance of your heart. Clinical studies aiming at testing the Bivacor TAH in a wider spectrum of patients, including those with complicated medical histories or comorbidities, are also in progress. The potential global impact cannot be overstated. Heart disease remains the leading cause of death worldwide, but the Bivacor TAH could dramatically reduce these numbers. It could also alleviate the burden on healthcare systems, especially in regions with limited access to donor organs. The advent of fully synthetic, mass-produced organs could revolutionize the field of organ transplantation. Business advantages and implications. The success of the Bivacor TAH is not just a medical triumph. It marks a major milestone for the biotechnology industry. The company behind this revolutionary device, Bivacor, has established itself as a leader in medical innovation. With the global artificial organ market projected to reach $60 billion by 2027, Bivacor stands to gain significantly. The technology has attracted substantial investments from major healthcare companies and venture capitalists eager to secure a stake in the future of artificial organs. The Bivacor TAH has not only proven its potential, but has also set a new standard for what biotech companies can achieve. As the device moves closer to full commercialization, Bivacor is poised to capture a significant share of the market. In order to guarantee the availability of the TAH globally, Bivacor's approach consists of not only selling the TAH as a product, but also providing surgeons with thorough training programs, hospital support services, and a strong supply chain. This all-encompassing strategy will guarantee that as many patients as feasible can use the technology, thus driving its adoption on a global scale. The Bivacor Total Artificial Heart's successful implantation in 2024 heralds a new chapter in medical science. It's evidence of human creativity and the unrelenting search for answers to our toughest medical issues. For those waiting for heart transplants, this technology not only gives hope, but also challenges accepted limits in healthcare. But as we look to the future, it raises an important question. Could artificial organs eventually replace the need for donor transplants altogether? And if so, what ethical considerations should we keep in mind?